Hello friends, I'm Dr. Amit Desai and we'll see the next question in our series MCQ for you. I take lectures in surgery and uh, anatomy for FMGE as well as NEET PG. So let us look at this question. A patient came with ascites. Ascitic fluid analysis was done and found to have SAAG of more than 1.1. Now, all of these can be a cause except. Now, what do we mean by SAAG? It is serum to ascitic fluid albumin gradient. So you have serum albumin on one side and ascitic albumin on the other side. Now let us assume that the serum albumin is constant. If this serum albumin is constant, then if the ascitic albumin increases, what happens to this ratio? This ratio decreases. Whereas if the serum albumin is constant and if the ascitic albumin decreases, this ratio is high. Which means that if you are dealing with something which is a transudate, which has a less amount of proteins in it, then the ratio will be high, that is more than 1.1. Whereas if you are dealing with an exudate, where the proteins are high, then what will happen is that this ratio will become lower. Okay, so basically there are going to be three such conditions where you are going to get what is known as a transudate and only one condition where you will have an exudate. Now they are asking you which condition is this, okay? So let us look at this, all right? Let us look at this. Okay, so see, these are the various conditions in which the gradient is high. If the gradient is more than 1.1 grams, it indicates that you're dealing with portal hypertension. Okay, you're dealing with portal hypertension. Now the question is that in cases of cirrhosis, what happens is that even the serum albumin is going to be low. So low ascitic albumin, the ascitic protein that is less than 2 gram percent, but serum albumin is also low. Okay, so this is cirrhosis. Whereas on the other hand, very high amount of ascitic protein you will see in cases of heart failure, pericardial disease, or veno-occlusive disease. Whereas if the gradient is less than 1.1 gram per deciliter, that indicates that there is no portal hypertension. This you will see in cases of infection, malignancy, nephrotic syndrome, or pancreatic ascites. All right. So these are the various causes of having a high serum albumin. Serum is to ascitic fluid albumin gradient. Okay, which is called as SAAG. All right. These are the various causes. All right. So if you have liked this video, please subscribe to our channel ADSL Academics. You please hit the like button and also press the bell icon so that you will get notification of all the new videos that we are coming up with. Thank you very much.